Me now for more on this is North Carolina Republican Congressman and Dr. Greg Murphy. Congressman, as always, thanks for hopping on with me, sir.
Good morning.
You know, you have this story, this outbreak coinciding with the fact that on Friday, 80,000 HHS workers were given that $25,000 buyout offer, including employees in the CDC. Yep. How worried are you about a good chunk of those workers taking the money who are actively working on the measles outbreak?
Well, you know, Markie, I don't know how many people were actively working on it. I've said since Congress, I got here 5 years ago, and I've been a physician for, now 30 plus years dealing with CMS and some of the institutions. We've overgrown our government. We've overgrown it. And so this is the time, especially given the fact we're in a financial cliff in the next 1 to 3 years facing national insolvency, we have to trim back our government. You know, the whole measles outbreak is tragic, and I think there are a lot of factors that are going in with this, but I don't see any of these layoffs or early retirements as having a factor.
Mm-hmm. You're a medical doctor. Do you agree with RFK Jr.'s push on vitamin A, cod liver oil, as preventative treatments to the measles? And what's your take on his recommendations right now?
Sure. The number one thing is to get vaccinated for measles, period, point blank. This is a good thing. It does not have a relation to autism, and some people have been pushing. This is something that can be not necessarily curative, because we know vaccines don't cure, but what they do is they cut down severity of disease. Vitamin A, if you are vitamin A deficient, can be a definite treatment for this to help ameliorate symptoms. But the biggest thing is we need to get folks vaccinated, and this is how this has happened in this country. People have come in outside the country who were exposed to somebody not vaccinated, and that's what's brought it to the U.S.
How do you think the federal government should be helping contain the measles outbreak right now, especially in states like Texas, where the outbreak is currently the worst? I mean, what is the federal government's role in this, you think?
You know, in Texas, the Mennonite community really, I think, is the one that's, from my understanding, been hit hard. Markie, the problem is, and people are going to start blaming RFK. Now, the blame needs to go back to Fauci at the beginning, because he pushed a vaccine that he put it outside of its use. And we got so much kickback because of his arrogance and his one-sided thinking that vaccine hesitancy has grown. Look, I'm a physician. I believe there is an absolute indication for certain vaccines at certain periods of times. But when we had somebody who was so monolithic in their approach, we had a lot of folks kick back in the United States. And that's going to be sad, because I think a lot of kids are going to be infected with measles who otherwise wouldn't have been.
Lastly, just before I let you go, sir, lawmakers, of course, are looking into making deep cuts within the federal budget that could trickle down to Medicaid, Medicare. What changes can people see who are dependent on these programs?
Well, I think people who are eligible for the programs for Medicaid, as is written under law, the eligibility for pregnant women, small impoverished children, disabled, those who are seniors who are impoverished. Those are the eligibility requirements. Those people who fit those, there's not a change in benefits. But Markie, I still see patients, and I see patients every time I do, that are on Medicaid that should not qualify. So reforming the system is long overdue, and it's not going to affect the benefits of those who have it and should have it. But for those who don't, their time has come, and this is absolutely an appropriate thing to do. As far as Medicare is not going to be cut. But what we need to do desperately is to go after the abuses of the Medicare Advantage programs. We've seen several insurance companies in the news a lot on how they've abused their privilege of serving American public. The same thing with our pharmacy benefit managers run by insurance companies. There's a lot of time for reform and accountability, and this is the time we have to do it.
You think that spending bill is going to pass this week, or are we headed for a shutdown?
I pray we're not headed for a shutdown. There's some things that I'm pushing really hard for as far as a doctor's fix. I pray we're not, because a shutdown doesn't help anybody. And for those who say that what we're doing spending is not enough, you shut down the government. Remember, you have to get 60 votes in the Senate, and those are Democratic votes. So it's going to be actually much worse in their viewpoint than if we just continue with what we're trying to do now.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.